Good morning, everybody. My name is Mina Ostovari. I am a research investigator at Christiana Care. Today, I'm going to talk about this project, which is about telemedicine and the impact on utilization, access to care, and outcomes of patients during the COVID-19 pandemic. Can you see my next slide? Okay. So the goal of this project was to study the association between some patient characteristics such as age, gender, and type of insurance, and utilization of services described by type of visits, office versus phone versus video, access to care described by waiting times, cancellation and rescheduling, and patient outcomes such as hospitalization and emergency room visit. So the first phase of this project is looking at care utilization. Our data source was electronic health records, and we identified 21,000 patients with a diagnosis of diabetes, heart failure, hypertension, and/or chronic obstructive pulmonary disease. The outcomes of interest is the type of visit, so whether it was office, video, or phone. And as we know, during the COVID-19 pandemic, because of social distancing regulations, most visits were offered through phone or video that represent telemedicine, but there were still some visits that were offered in person and at the office. So briefly looking at some results here, our patients population, we had similar number of male versus female, so 10,000 male and 11,000 female patients. And the average age was also similar for these two groups. Looking at pre and post-COVID visits, we can see that pre-March 2020, which is when COVID hit most states, including Delaware in the United States, we actually just have office visits. And although there were some visits that might have been telemedicine, phone, or video, we don't really see that because they were not billed. And after March 2020, we can see different types of visits, such as office, phone, or video. We see a higher number of cancellation post-March 2020, just taking that with a grain of salt because the health system was going through so many changes and some patients might not have been familiar with how to use telemedicine platforms. Another thing to quickly look at is the type of insurance coverages that patients had. So the highest percentage of visits were patients who had Medicare, followed by commercial. And if we look at different types of visits, we can see that the percentage of visits that were office and phone visits are similar for these two types of insurance coverages. And we see that video visits have a lower percentage. So we are going to do this kind of analysis, and we are going to do some statistical analysis. It helps us to better understand the needs of our patients, and eventually we'll be able to improve our care delivery, planning better for the future of telemedicine in the health systems based on the needs of our patients, whether we need to increase the telemedicine services that we offer, decrease it, or keep it at the same level. And we also be able to provide telemedicine services to a group of patients who may not have access to care during COVID-19 pandemic because of health disparities, and plan for these patients to improve their access to care. So with that, I would like to thank you. If you have any questions, I can answer now, or you can reach out to me later. Sorry, it went over 20 minutes, like 2 minutes, sorry. But I'm done now.
Thanks, Mina.
So I try to keep it brief, but I guess it's just not possible because there's so much that I still didn't share.
Well, but that's part of why we do this. I mean, that's right. Like, how do you do the triage of all that stuff?
Yes.
So some of the there are some community engagement folks who were on, so I'm going to throw it to them first. Just chime in.
Heather, I see if you're on. I don't know if you want to start with feedback.
Sure. So that was great, Mina, and I will say that I think your, the topic is, really important, really pertinent. In terms of an elevator pitch, the first thing that stood out to me was what lens should your pitch be? And I guess I would imagine if you were giving an elevator pitch, you would almost need two different ones. If you were presenting this to the community at large, like the Delaware, people in Delaware, I think what they would want to be interested in, well, why do we care about what kind of visits people get? That sounds like, a technical thing. But I know that that people in the community should care because there's, likely to be disparities in the who can access medicine type visits, and that disparity in access probably has very real implications should there be another pandemic, God forbid. And I think you need to make the case that basically these changes are here for good. So we may have, thought, well, telemedicine is something we scrambled to do to respond to the epidemic and the pandemic and to give people access. But no one doubts that it's changed the way that we deliver care, and that's going to be, the case path forward. So I guess if you were presenting and I would really think you almost have to do sort of two different, slightly different. I think the community would care about that.
Right.
But I think you're almost went a little bit of a different direction, which I think is just as pertinent, which is if you were presenting this to some kind of healthcare leadership. And if you can you go back to your slides? All right, so the project goal, and this is in absolute deference, even with project leadership, I think you need to simplify this like way more in the beginning. The project goal is something along the lines of understanding who can use these services.
Okay.
And what impact that has on those people's health. Or what that has to, because I would say that, and I would just pick a little bit, but, better your friends do it than someone else.
Yes.
Patient outcomes, maybe hospitalization and emergency room visits, but those are really healthcare access outcomes. For the most part, that's the administrators that care about that. Patients care about getting better. Do you know what I mean? Like, so just, to kind of keep that in mind. So it's fine to kind of have this wording up on a slide, but I think you need to come up with a quick statement that's real simple. We want to know who's accessing these things and what it does to their health.
Okay.
And then your next slide, I think it was.
Can I ask a quick question on it? I'm just curious, Heather. It's Rob. So just go back for 1 second. So from the community perspective, should we be thinking about an even longer term goal? Because the goal is to make sort of this kind of access more efficient. Right? That's the actual goal, more efficient and effective. Even though that's not the goal of the specific study, ultimately that's why the study is being done. But I'm just asking this kind of curiously. I'm always wondering, like, how far out should that flag be that you're telling people in the community, this is what we're trying to do, to give them context and kind of this is the reason. But what I found, if you do that and the flag's too far away, they're expecting you to accomplish that in some near term. So I'm always kind of struggling. Well, how do you put the context of the project goal, right? And so in the case of Mina, and I'm just paraphrasing Mina, it's to improve access, improve the efficiency, right? But that's not going to happen tomorrow. That's not going to happen at the end of this one. And I don't know if I'm asking this question well, but how do you kind of figure out what's the goal that's relevant to the community, unless you do something like this, and then don't oversell it, because that's almost worse. We're going to fix this, and then you don't. That's almost worse than not saying it at all, right?
Right. I mean, but that's why I think that's the beauty in some ways where you can use the lay language. I think you could say, one of the biggest struggles in medicine is getting people, into those encounters. And, this, however you want to say it, now this isn't very lay friendly, but, this work contributes to that larger body of work, something like that. This is one small part that's moving us along towards this big lofty goal of making sure everybody can see the doctors and providers that they need to, even if they can't drive, walk, show up in person. I think you can say, you can paint that bigger picture of it's hard. This is one pillar that's, going to lead us to, that will contribute to fixing it. And this is one step. I think you get me. But yeah, it's hard. I think you don't want to overpromise. But yeah, I think you're very right.
Can I chime in? This is Kyoko.
Hmm.
So, I mean, I understand Rob's point that you can't overstate, but I still like to see what really this project or this research findings gonna move something good in the community, or something create. And Mina is really working on a really large size data here, and that would impact a lot of people, not just the patient, because if there's a small company and then there's workers who gotta go to the emergency room, but if that can be preventable, if they could access the telemedicine and then reduce the time of the 6 hours or 6 days, that would be more impactful in a business wise. So, and then if the kids get sick, and then if they could do a little bit telemedicine before that, that is also be helpful for that, because the caretakers doesn't need to take a sick days, or they might be able to actually do work from home, and that's a really like a big sort of like benefit from the telemedicine. I mean, I'm not that familiar, but I would take that, and I think everybody understand that, and then that would be more relatable, not just the sick people, but that would impact you in a business wise, and then also like the family wise. I think if you add some sort of like a really additional impactful component, that would be more, relatable, as I say. So that's my suggestion, but I don't know if this is too much to go, but at least I feel that way, that if I see this and then I see that, and then that's more interesting.
Kyoko, I think you've hit upon it. Maybe the way to go with this is you start with, the promise of telemedicine, right? It's kind of an attention grabber, and then you could list all the things all the hopes that are essentially pinned upon telemedicine. That people are going to have better access. It's going to save money for small businesses. It's going to, all these things. Just one line, and then you go into, and the part of this, the part that this project contributes is we're going to look at in our system who was able to do this. What do you guys think?
I mean, I think it's great, but for me, it just, I've always, because my mind goes like scientific papers. So it's always, if I say this is the goal, I have to defend it later. So when it comes to community, as Rob said, like, I don't want to overpromise and then this just not that. But I understand from perspective of community, it's like, okay, what's the impact? But I think I still struggle. And when I say something that I don't have something to defend it, then I'm like, oh, maybe I shouldn't be saying that. But I understand both point of views. Yeah.
And that comment resonates with me, right, a lot with scientists, because it's all proof and you're building on top of things. But I think if you switch it around a little bit, and rather than making it sound like you're promising to fix telemedicine, just you have to present it like, well, there are challenges. Like, we have big problems, and telemedicine has a lot of promise to fix these problems. And you have to figure out a way to say it positively, not negatively. But
Yeah.
defining the scope of the problem is easily defended. And then, so once you have sort of the big scope idea, this is the big issue, and you've got everyone's attention. And I like Kyoko and Heather's suggestions. Then you just have to kind of, this little funnel thing that I probably talked to you about, you need to get them down to the very thing, and then you've got to be able to defend all of it, because the scientists are going to expect that, and you're going to have to be able to defend it. You can present it, I think, I mean, I'm not very good at it, but you could present it in a way that the community understands it. But in terms of talking about the why you're doing this, what's the scope of the issue, that you don't have to defend. It's a generally accepted problem. right? Same thing when grant writing, you have to say, what's that long-term goal? What's the big thing, right? There's always, I'm going to fix these kids part of a grant, and this is why they need fixing, and then you explain exactly what you're doing. It's
Yeah.
the same sort of rubric. And I like that, so it resonates with me because at some point you have to switch. I mean, you have to tell them exactly what you're doing.
Yes.
And right for us, for the sciences, it has to be right or as right as we can be at the time without kind of being too confusing. But maybe that's the way to think about it. It's the why first. And what's the big challenge here? What's the big promise? Um, I don't know. Heather's leaning forward because she's gonna.
This is Erin. Can I actually just say one thing so I can, because I, consider myself community because I am definitely not a scientist like all you guys and the data and all that stuff. So the things that I think of when I think of an effective elevator pitch is the first thing you have to do is know your audience. So who are you pitching it to? So if you're pitching it to scientists, that's a whole different presentation versus if you're pitching to a community. For community, and again, it depends what type of audience that is, but think about people in the audience and if it's somebody like a parent or a patient who may be using a telemedicine or a caregiver, they're thinking of, okay, I got to get mom to appointment at 12 o'clock, but then I have to be home for my 2 o'clock meeting. And then I got to make sure I have dinner ready, all that stuff. So I always think you have to start with your hook because their brain is already everywhere else to bring them in. And I think with telemedicine, the nice thing about telemedicine to bring people in to hear your presentation is you simply have to point out how many people have used telemedicine in the last year since the pandemic started. And then you can explain why what you're doing is important. Because I would bet that almost 100% or close to it of the folks on this call had some connection with telemedicine in just the last year. So you can easily get your audience in. And then the only other thing I would say is just be careful using a lot of data. Again, it depends on your audience. So if it's some numbers are important as scientists, but for somebody in the audience or the community, some of the numbers you may look at and think, well, how does that affect me? Or, okay, that looks like a number, but those are just a bunch of big numbers. So make sure if you're using data that it's something that is easily relatable to the audience.
Okay.
Good job, Mina. You did good. It's not easy, that's for sure.
Yeah, I think Erin doesn't need anybody else. She hit it all on the head there.
Yes.
I think your who is super important. And this is very different than a grant or a manuscript, right? Where you're getting as quickly down to the details as possible because you're trying to convince people that you set your experiment up right, that your findings mean what they mean. This is different. This is like the elevator pitch. It's why should why should Janice Nevin or any other CEO of a hospital, continue to support this type of research? Or why should the community feel like you're doing something meaningful for Delaware when you do this? So it really is about, creating that bigger why. I love the idea, anytime you need the hook. Everybody in this audience probably did telemedicine, but who's left out? Something kind of a little commercially like that. I'll be quiet and let somebody else talk.
I just wanted to add one thing. So I think that, I'm not good at giving these short things either, but even as a science person, I was completely overwhelmed. I would simplify it to about 1/3 of what you said. And I am a fast-talking New Yorker, but I think you took one breath at the beginning and talked during the whole thing. I would literally, I don't think you have to tell every single piece of data. I think you have to get the hook and just get them interested in a much more conversational tone than I'm going to tell you everything, because really right at the beginning, I got lost and then my brain turned off because it was so much said so quickly. So I would put about 1/3 of what you had in there in the same amount of time.
Okay.
Yeah, like for instance, I think for either the community or for, if it was healthcare leadership, that slide you have, which I think is the next one or two, that's like the number of visits, pre and post. I think this one, I think all people want to know, you know what I mean? Like, I don't think you need that. I think all people want to know is something along the lines of like, how many visits did you look at pre and how many did you look at post? And I don't even know if they need numbers. I think they just need to hear that you looked at enough for it to be meaningful.
Oh,
You know what I mean? So, you didn't, it's Christiana Care. We had, a large number of visits over blah, 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 pre and this many posts. Just tell, so, I'm telling you these numbers are meaningful. They may not represent the whole country, but, we weren't just looking at 5 patients,
right.
something like that.
Oh, I see.
I like the idea, and I'm going to say the same thing, Anne Marie, I might have said it before. I'm not that good at this, but what I try to think about is who you're talking to, the audience, but then also think about, well, what are you, like, why are you talking to them? Some of it is you just want to give them information. They ask for information, but a lot of times those interactions, you're also trying to get feedback from them. So so when I'm talking to families or groups of families and patient groups, usually I'm updating them and trying to figure out how to tell them. But what I really want is for them to tell me what they think. So then I start calibrating, okay, well, how do I get that kind of response from the audience? So that's another thing to think about. If it's Janice Nevin, who's the CEO for Christiana, right? PSR on TV, you have like that to get on her radar to protect your program, right? So that's different, as has been pointed out. And what you're looking for back from her is just approve, like, make sure that stays there. You're not looking for anything immediate. But sometimes when you're talking to families or groups, you're trying to get feedback from them, and you have to give them enough information to get that kind of feedback and make sure that communication happens. Somebody else say something?
No, the thing that I struggle with is I don't want to, well, I want to respect like the intelligence of the audience. At the same time, I want to make it like, so finding that balance is not easy. And also like, I understand like this is for practice, but when I'm presenting to somebody, if it's like an elevator pitch, we just don't even need like PowerPoint presentation. I could just like, I talk to them. But when I am doing a PowerPoint presentation, if I'm doing it for the community, like what should the content be? Is it just one slide? If it's one slide and I say everything on it, wouldn't that be overwhelming? So that's like finding the different balance. And like my mind is always, again, just it's about transitioning to a different audience, but it's always about, okay, this is the introduction, this is what I did, this is the result, this is the conclusion. So that's how I'm programmed for years and years. So now switching it to, okay, you just want one slide and doing this. I don't know. As I said, I have never been good at that either. I never presented my dissertation in 2 minutes or so to win. I'm like detailed. So
yeah, but it's a skill we don't teach. It's a skill that's needed in scientists, but it's not taught. I agree with that. In fact, it's sort of beaten into people isn't the right way to think about it.
Yes.
But not using active language, not saying any, like you're taught to kind of speak in a certain way in a certain parameters, in a certain context, in a certain sequence of information, and that's very strongly kind of imbued into scientists. And you really need that. Probably 75, 80% of your communication is that way. But the other 20% is hugely important, and I think we do not do a good job, which is why we're trying to do these practice sessions and elevator talks. So you do need to be able to deliver the essential, like identify the essential pieces of information, deliver them to many different types of audiences, and do that in a way that gets the information back that you need. That if you're looking for engagement, or you're looking for information, or you're just you're trying to communicate both ways, and that is really hard to do. That's one of the reasons we're doing this. And I think if you take this information, and Erin, I can't remember what you'll practice another one, right? Another elevator pitch, shorter, more focused on sort of the feedback that you got from here. you'll find it's leaps and bounds. And then even after doing that one, the next one will be a little more sort of automatic, right? You won't have
Yes.
to struggle as much with it. But I agree, it's I think, the scientists who've said, who talked, all say I'm not good at this either. We're not trained to do this. We're not even trained to think like this. And a lot of scientists aren't even trained to talk to the public at all.
Yes. And actually sometimes, as you said, trained to do like completely like an opposite thing. Like, yeah.
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 So this is a Kyoko again. I think sometimes PowerPoint slides, I feel like that's my safety blanket. And because I clinging on it, and when I present, I feel safe because all the data are there. You can see it. If I forget what I say, they can see it, and then I don't need to really, explain about it. So just like I said, it's a safety blanket. So when I did my elevator pitch last time, I intentionally didn't use my slides because I knew that's gonna, like that way. And imagine like you going to just a regular social party with not your colleagues, but somebody else. Like, think about going back to high school and then have a little bit chat. And then, so what are you doing at the work? And then you gotta kind of explain in an easy way because you don't want to present yourself that you're doing something boring or something not important. And then you're gonna have a really short time and you don't have a slides to go. So you can kind of, explain really easily that way. That's like a social occasion. And then I think, yes, we are not trained that way, but in a reality, you go to the conference and then you're going to have like a dinner with somebody else who are not in the specifically like, area of expertise, and then you talk and you tell about what you're doing. So basically, that's something in the line. So it's not need to be really, really get down to like, talking to the child. But but at the same time, you kind of want to present it that way. And I think that might help you a little bit to kind of change your mindset from not to going to presenting another science per se. You kind of give a little flavor to it in a sense. So it's credential and it's reliable, but at the same time, you don't need to provide a statistical significance in a sense. So so that's like it's a good enough, but not that go into much details. And then that I hope that will help you
I
to
think
tune
that's
sort of
great.
into some
That's
area.
very well put. We're still recording this, right? 'Cause that was
I hope
very
so,
well
because I'm not gonna
worded.
remember.
And I just want to point out, and Kyoko like got right to this point, but didn't. Maybe she knows this or not. There are studies and data indicating how bad PowerPoint is for communication. So our scientific sort of reliance on showing the figures from our paper, and then I forget, you used the word, it's like a crutch or something, Kyoko. You said it much better than I'll be able to say it. That's really a good way to have a bad talk. The slides are supposed to support what you're saying, not drive what you're saying. Although we all use them, like I make sure slides when like if you get interrupted or something, I can just go to the next slide, look at it, and get right back on track. So you can use them that way. But yeah, it's an excellent point. We're gonna have to splice Kyoko's comments out and write them down. It was very well put. So,
And Mina,
so
one thing I think you did really well is, and then I see this from everyone who presents, is that you're passionate about your work. But that does make it easier for people who don't understand because we're drawn to your passion. So as long as you continue to do that, that's great. And then I always say to folks when you're presenting this, so you guys are experts in your field, right? So imagine if you had to talk to somebody who maybe their expertise was in economics, or maybe you're not a sports person and they want to talk to you about sports. you would have to think about how would you want them to communicate to you so that you can understand why their passion is so important. So that's the same thing as when you're communicating your science. Communicate it to an audience to explain why your passion is so important. But it's not easy, and you did a good job. So just keep that in mind.
Yeah.
Thank you, Erin.
Nice job. All right, so thanks again, Mina, and everybody who participated. Any last thoughts, questions, issues people want to bring up before we go?
One quick comment. People don't usually get insulted when you say something they know. It actually is, in a way, a hook for them to continue to pay attention and feel like they're an insider in what you're talking about.
That's a good point. Thank you, Heather.
Also recorded, right? Because I'll go, Heather said something. All right, well, thank you, everybody.
Brave enough to do the next one. It's August 5th, and we need somebody to present. And I think folks are seeing that these are very valuable. So if you're interested in doing the next one, August 5th.
Excellent. All right, thanks, Erin. Great job. And thank you, everybody. Enjoy your. Hopefully, everybody has a long weekend. I'm not sure, but if not, no matter what, we'll see you next week.
Bye.
Bye.
Bye. Take care, everybody.